the Town Hall. Please go ahead with your question.
Thank you. I'd like to ask, I keep hearing about ineffective hospitals because of lack of capacity, and I'm wondering why haven't they put extra beds in those kilometers of grandiose empty spaces?
Thank you very much for the question, Renee, and I will ask Eric Vanderwall to talk about the capacity levels at the hospital. Go ahead.
Thank you, Mayor Mead-Ward. Renee, thanks for your question, and thanks for the opportunity to clarify this. This is really an important issue for everybody to understand what's truly going on across the healthcare system, and in particularly hospitals. So as you know, this is characterized as a fifth wave of COVID-19. And over a course of multiple waves, we've seen significant reductions in staff working in the healthcare industry. Healthcare workers, nurses, and others have either chosen to retire early, to move into other fields, to potentially change their career path. And so we have seen a real pressure during this past wave on health human resources. So interestingly enough, there are physical beds built and available in the province. The challenge is there aren't the staff to actually staff those beds and surge up to meet this increased demand. And I know firsthand some hospitals across the province are having trouble even staffing their baseline level of beds before COVID, never mind now having to be able to surge up and create additional capacity to care for COVID patients. So this wave has really been one about shortages of healthcare workers being able to staff the beds. I know at Joseph Brant Hospital, our staff are coming in every day, regardless of their personal situations. They've made a lot of sacrifices, and they show up every day, and that's what a healthcare worker is. They're tired, they're stretched, and they're looking to the end of this pandemic. And so how can we help a system that doesn't have the ability to create the capacity it did perhaps, say, in the third wave? We have to follow public health measures. We have to not contribute to transmission of this disease, and draw on other care services where most importantly, like not go to the emergency department if you have mild COVID symptoms, call your family doctor, call telehealth. These are all ways that we can help our healthcare workers and our healthcare system get through this fifth wave. Thank you for the question.
Thank you for that, Eric. And we are so grateful to all of the work that our frontline